Straights or butterflies? Pick your poison. Hello everyone, and welcome back to Flo's Corner. So in this video, I'm going to be discussing the most commonly used needles that we use for venipuncture / blood draws. So please stay tuned. Oh my gosh, did you guys see it? How do you like my new intro? Definitely like this video to let me know that you guys like it or anything I need to change or whatever. I would really appreciate that. But back on to our video. So today I'm going to be discussing about the needle sizes that we use to do our blood draws. This is something you're going to be learning in your phlebotomy career, obviously every single day, because you're going to be using needles to get your successful blood draws going. So you're going to need to know all of these sizes before you even start your phlebotomy career. To anyone who is new here, my name is Flo. I am a certified phlebotomist. I have been a phlebotomist for a few years now. I am in no way, form, shape, or fashion a professional educator. Everything I discuss about phlebotomy is from my personal experience that I want to lend a hand to someone else who is just thinking about doing phlebotomy. And however, honestly, before I jumped on the phlebotomy train, obviously anybody can learn the book smarts and the book wise and everything like that, but I really wanted to make sure that people actually see what's it really like by someone who's actually in the field. And I felt that why not use a platform where I can do this? So I really hope my videos will be inspiring to anyone who is very interested in phlebotomy, even if you just don't ever want to be a phlebotomist and it's just something you just wanted to know about. I really hope that I am making a difference in your life some way. Always feel free to let me know any questions you have, any type of criticism or comments or anything of that nature. I will definitely try to help you out as much as I can. Definitely hit that subscribe button if you would love to see way more phlebotomy videos, and definitely like these videos so I just kind of know that I'm kind of making a difference somewhere, you know. And I also have my videos on playlists, so if you're interested in like phlebotomy, if you're interested in like some of my recipes and things that I sell, anything like that, I try to, everything is free. I'm literally just a free person. I want to give my knowledge to someone else to help them grow in any type of career that they would like. So definitely check out those playlists because they're all in one little playlist. So if you want all phlebotomy, you can pick my playlist of the phlebotomy if you're interested in however. But back onto the video. So just like I always mention in a lot of my videos, phlebotomists are just not always placed in just clinics and hospitals. You can be everywhere. You can be in blood donation centers, you can be in plasma centers, you can be in other places that need a phlebotomist for their patients to have some type of blood drawn, whether it's therapeutic phlebotomy or however. Okay, so no one should ever be new to what needle sizes are. So most of the time, whenever you see a needle size, you will always see a G next to the number, and that just stands for the gauge. So this is just some quick information. The higher the gauge is, it's going to be how much smaller the hole is. So I have explained to friends, patients, and even family members that when they hear a higher number before the G, like if you say 25 gauge, they'll think it's like a really big needle. Oh my God, it's huge. I'm going to bleed out. Oh my gosh. It's not like that when it comes to needles. Needles, honestly, the smaller the number is, the bigger the hole of the needle. So I will admit, when I first learned that, I was like, whoa, because I mean, you think about it. Oh, it's bigger number, higher number. So that means it's huge, you know, and it's like, no, it doesn't go that way when it comes to the needles and the gauges. So that's just a quick tip. If you're ever wondering, like maybe you went somewhere and they said they were going to give you an injection or whatever, if you wanted to know the needle size so you can kind of be aware of how big the needle may be, then so be it. So if you go somewhere and you'll be like, oh, okay, well, there's an injection I'm going to do. Oh, okay, well, what kind of needle gauge are you getting ready to use? So you kind of get yourself prepared. Honestly, you don't have to do that. I'm just saying, if you would like to know, that would be great. I mean, I'm a phlebotomist, so yeah, you know, anything I've getting an injection or vaccination or whatever, you know, what needle size you guys using? Cause okay, I know. I mean, obviously it's not a big deal for me, but if you're ever wondering, I'm just letting you guys know, the higher the gauge, the smaller the hole. The lower the gauge, the bigger the hole of the needle. Okay, so the first one is going to be a 16 gauge. A 16 gauge needle is obviously, you know, the lower the number, the bigger the hole. So that is going to have a bigger hole, and the 16 gauge is normally used for when like a patient is donating plasma. I've never really used a 16 gauge ever. I know exactly what it looks like, but I have never used that. Now on to the next one. We're going to have the 18 gauge. Now the 18 gauge I know for sure can be used for donating blood, like at blood donor centers. So that means that the 18 gauge is going to be smaller than the 16 gauge, but it is still on the bigger side aspect, and that's only mainly for donating blood. Like I said, I have never used an 18 gauge at all for blood draws unless it was donating blood. They also use the 18 gauge for therapeutic phlebotomy, which is like donating blood to like check for diseases and things of that nature. So the bigger the hole normally means that it's a more of a faster blood flow versus a smaller hole of the needle. Because honestly, who would donate blood with such a small gauge of a needle, like a 23 gauge, and you're like, well, I'm trying to donate blood. You'll be there forever for that flow to actually fill up anything. So definitely the bigger the needle, it's going to be for stuff like I said, like donating blood or donating plasma, things of that nature. Now we're going to jump into what you're going to mainly see in your phlebotomy career, whether you're working in a hospital, a clinic, anywhere. These are normally going to be your main gauges of the needles that we are going to be using in this field. So here I'm going to switch over to a voiceover. These are the needles that I have at my clinic. These are the 21 gauge, the 22 gauge, and the 23 gauge. So the next one on our list is going to be the 21 gauges. This is a straight needle that has the safety on the needle, and this is another 21 gauge straight needle that doesn't have the safety. So you will use a hubcap with the safety. This is a 21 gauge butterfly. This is the push button one, which means that you just press a button and the needle will retract from the patient's arm. Here is another type of butterfly needle, which is still the 21 gauge. And this one you do have to remove from the patient's arm, and then you will activate the safety. Okay, so the 21 gauges is always going to have a green top. You're going to notice that normally with the butterfly as well, they are going to be considered the green ones. So these are pretty much the standard, most common needle gauge that we will mainly use for most of our phlebotomy career. Like, honestly, that's just the main common size needle that you're gonna use. So this is gonna be for your routine blood draws and venipuncture. It's pretty much very common in the phlebotomy world, and because of its still being small enough to be comfortable, and it also offers a fast blood flow rate. So because of how fast the blood flow will be, that cuts down your blood collection time by a lot. So you pretty much will, when you're using the 21 gauge, the blood is just flowing. It's going, it's going, it's going. So the next thing you know, you're in and out of the vein and the patient's arm like that, normally with a 21 gauge, if you had successfully stuck them the right way. So that's awesome for you because that speeds up your collection process, which means that you get to go on to do the next patient. A quick tip, 21 gauges should be used most of the time on someone who has like a really good vein size, like a standard vein that looks like, you know, prominent and feels prominent. You know, it's on the bigger side, like, ooh, bam, baby, I'm gonna catch this with a 21 gauge, no big deal. Blah, blah, blah. You be in and you be out, and boom. I like to use my 21 gauges when I feel that big juicy vein. Sometimes I can see that big juicy vein and I'm like, yeah, baby, we about to hit this for the 21 gauge and call it a day. So those are normal for the standard vein size. You really honestly wouldn't use too much of a 21 gauge if you're really having a hard time really trying to feel a vein and anything of that nature. Anything if you do not find the vein, I would not recommend to use a 21 gauge because you may miss, you may create a blown vein, you may create hemolysis of the specimen. You don't need any of that. So 21 gauges is definitely like someone just has really good prominent veins that you can really feel. You know, obviously phlebotomy is always about how you feel, what you feel and not by sight. So always make sure that you're really feeling that vein bouncing back and you know this is a juicy vein. Boom, use the 21 gauge and you should be fine. And just a quick tip, the 21 gauges come in straights and butterflies. So remember that. But definitely the 21 gauge is something you're going to definitely be using and seeing a lot in your whole entire phlebotomy career. That is the normal standard size for our blood draws. So next is going to be our 22 gauges. These are straight needles. They come with a black top. This is the one that I have that has the actual safety on top. And then I also have another one that doesn't, but you would just use a hub with a safety lever on top. So I normally use my 22 gauges on like my older children patients, more like teenagers. It's still just smaller than the 21 gauge, but it still gives you that fast blood roll rate. But make sure that they do have a really good prominent vein, and you can also use the 22 gauge for a little bit more comfort for the patient. So this is our prominent butterfly needle. This is a 23 gauge, which is normally used on very thin, fragile, very small veins that you really cannot use a bigger needle gauge to get a full successful blood draw. So the 23 gauge is normally used on like my neonates, my infants, very small children, some of my geriatric patients as well with very fragile veins, very fragile skin. And I have used 23 gauges on adults as well, because some people just don't have great veins. So the 23 gauge just gives you that comfort. It's very small, very small. Not super small, but enough for them to have enough comfort to get inside of a smaller vein versus a 21 gauge. So your 23 gauge is going to come in as a butterfly. Butterflies are really just called the wing infusion sets, which just shows like the little wings on the little needle. The only con I would say that every phlebotomist doesn't like about the 23 gauges is that it takes forever to fill up your tubes. So whenever you are trying to stick a very hard stick patient or someone that has really small veins, when you're using the 23 gauge, it doesn't flow on a faster rate. So it kind of has a slow, kind of like a slow drip. It's going to fill up the tube. It's just going to take a little bit, not, you know, like so long, like you're waiting hours for it to fill up, but it can kind of slow you down a bit. So I think every phlebotomist I've ever heard doesn't like using the 23 gauge unless it's necessarily possible to need to do so. But yeah, that's the only con I would say about the 23 gauge, is that yeah, it's gonna drip a little bit more slower to take a little bit longer to fill up the tube. But you do have to remember the 23 gauge is on the higher gauge, so that means it is a smaller hole. I do know of some patients that do say the 23 gauge butterflies normally are more comfortable than the 21 gauges. So it depends on just your pain level and your pain tolerance. Now, next I'm going to go into the 25 gauge. The 25 gauge needle is for really small veins. Now, I have used a 25 gauge needle for an infant. Most of the time, the go-to for our neonates and our infants is going to be a 23 gauge, but you do have certain circumstances that you may have to use a 25 gauge needle. But with the right practice and the right precision, then you can get the successful blood draw using a 25 gauge needle. Just some quick information. Anything after a 23 gauge, which means it's going to be a much more smaller diameter of the needle, may give you a hemolyzed specimen. And you guys know I explained this in one of my other videos. Hemolysis doesn't always work with the lab, so your specimen can get rejected and then the person becomes a redraw or recollect. Because that hole is so small, it can rupture or damage some of the blood cells, which will cause hemolysis. And like I said, that's just something, that's the risk that you take when using a really small needle, which is anything most of the time over like the 23 gauge. Well, not over, but you know, like smaller than a 23 gauge. So pretty much you can use a 23 gauge as well and still cause hemolysis, depending on the proper, if you haven't used the proper technique when collecting this draw. So it can happen with a 23 gauge. Heck, it can happen with a 21 gauge, if you want to call it. It can happen with any needle, but you know, you risk more of a risk factor when the needle is a little bit smaller than a 23 gauge. So here are all of my needles that I use at work. These are the ones that I've been using since my whole entire phlebotomy career has started. These are what you call your safety vacutainer holders. Pretty much we call them hubs if you like. They have a small hole at the top, and on the bottom obviously it's going to be wide enough so you can place your tubes. One may have a safety lever on it and the other one may not. So here I'm going to show you how I pair up the needles with the hub. So because these needles do not have the safety on the actual needle, then you're going to need to use the hubcap with the safety lever on them. Never pair up hubcaps or needles if neither of them doesn't have a safety lever. That can render a needle stick injury because the needles is exposed. Here are my needles that do have the safety lever on them. So you're going to pair those up with the hubcap without the safety. Most of the time, your laboratory supply or your managers will supply the right needles with the right hubs. So most of the time, it just depends on where you work. You can mix match it if that's all you have. There's no big problem. Needles and hubs just needs to have one another, and one of them at least needs to have some type of safety. Now, for your butterflies, you can use either of the hubcaps. I prefer to use the one without the safety so I can hold on to my one with the safety for my needles that need the safety. Most butterflies have their own safety connected with the needle. So here I'm going to show you how to pair one of the needles that doesn't have the safety with a hubcap that has the safety. So a blood draw needle normally comes with the needle on one side and then another needle on the other side that is covered by a rubber sleeve. So on your straights on the color-coded side, you're going to see that that's where the needle is. And on the other side, that is where another needle is covered by a rubber sleeve. That is what you're going to place into your hubcap. To remove, you are going to twist it slightly and the little cap is going to come right off. There are two caps. It's going to be one over the rubber sleeve and the other side is going to be of the needle. But you're only going to take the rubber sleeve side out first and you're going to insert it at the top of the hub. All you're going to do is twist it in place so that it is firmly secured. Also, just be cautious to make sure that you do not puncture yourself because the other side with the rubber sleeve is a needle. Do remember that. Now I'm going to demonstrate again for you. Don't forget the colored side of which is the black top is going to be where the needle is, and the other side is going to be with your needle with the rubber sleeve is on. And you're going to do the same. You're going to remove it and then place it into the hubcap. Now we are ready to remove the top cap to expose our needle for our blood draw. So you're just going to pull slightly, and as you can see with the needles that don't have the safety on them, the bevel is not in the right direction. When using the hubs with the safety lever on it, you will turn, which is going to rotate your lever so that when the needle bevel is facing up, that is the proper way to use the hubcaps with the safety holder for a needle that doesn't have its own safety lever. So in layman terms, your bevel will be up and also your safety lever will be up towards you when you are drawing blood. When you are finished, you will remove the needle, place your thumb and activate the safety lever onto the needle. You will hear it click and it is safely secured. Then discard in the sharp spin. Now I'm going to show you how to use the needle with the safety on the needle and a hubcap that doesn't have a safety on it. So it's pretty much going to be similar. The same color top means that that's where the needle is, and the other side is going to be where your other needle is with the rubber sleeve. So you're just going to remove it as if you did the other needle. One big difference when using the needle with the safety lever on is that when you remove the cap on the needle side, your bevel is already going to be facing the right direction, which is going to be up, and your lever is going to be lifted up towards you. That's perfect because you are ready to go as soon as you put it inside of the hubcap. And like I said before, it just depends on where you're working and where they get their supplies from, that you may have some needles that have the safety on it, or you may just have the needles that don't and you have the hubcaps with the safety on it, just depending on where you work and how they order. So now when using these certain needles, you are going to lift the safety lever towards you, and then you can remove the cap from the needle to expose the needle. And you can see here that our bevel is already naturally up when it comes to these needles. I love that because, like I said, it's just boom, bam, boom, and you're getting ready to get started. And now you're ready to begin your blood draw. You're going to anchor your vein. You're going to insert your needle at a 30-degree angle. Once you are done, you are going to lift your thumb and place the safety over the needle, and you're going to discard that into the sharp spin. Never remove the needle from the hubcap once you are finished with your blood draw. You will not use it again. That will go in the sharp spin just as much as the needle will as well. They go in as one unit. This is a 21 gauge butterfly. This one in particular has a push button, which means that you press a button and the needle will retract inside of the butterfly once you are done with your blood draw. All butterflies I've ever used always have their own safety devices, so you really don't need to use a hub with a safety on them because they have their own already built in. So on this particular butterfly, you can see that little black dot right there in the middle. That is the button to retract the needle. One key tip about butterflies is that you're going to notice that the back of the butterflies has like these little grooves on them. That is where the bevel is going to be down. You always want to turn your butterfly the other way around, where the bevel is going to be facing up. Here you can see that it still has the rubber sleeve end, which is going to be inserted into your hubcap. Like I said, it doesn't matter which hub you decide to use, but because the butterflies already come with their own safety, then I just prefer to use the one without the safety on it. Now you are ready to perform your blood draw. It is up to your discretion on how you would like to hold your butterfly needle. I prefer to hold the wingtip when inserting. Now you're going to remove the cap from the needle to expose the needle, and you are going to insert at a 30-degree angle. Here I'm just showing you that the bevel was up. Here is another way on how you can hold the butterfly needle when inserting it into the vein. You can lift both of the wings up till they are touching each other, and then you can insert inside the vein. It is literally up to your discretion on what you like to do. Now, once you are done, you are going to activate the push button, and that is going to have the needle retract. I prefer to do this while the needle is still in the patient's arm, for it can just give it an ease retraction, which will cause less pain. You're more than welcome to remove the needle and then activate the button. Now here we have our 23 gauge butterfly needle, the light blue. Remember that the grooves is in the back, which means that is the back of the butterfly needle. That means if you are going to insert with the grooves facing up, then you are inserting wrong. Grab your hubcap, and then you're going to insert your rubber sleeve needle into the hubcap once again. Make sure that it is secure on there as much as possible. Here you're going to remove the cap from the needle to expose it, and then you are ready to start your blood draw. So the way that we activate this certain butterfly is the safety lever is going to be at the bottom. You're going to hear a click when you are activating the safety lever. So once you hear it, then you're going to slide up the bottom part of the butterfly body until all of the needle is covered. Your thumb is going to play a crucial part in activating all of the safety devices on your needle. I'm telling you, like, I use my thumb way more when it comes to activating these devices. Here is another type of butterfly that I have. This is a 21 gauge one. Now this one, you're going to have to activate it yourself, which is going to be pushing up the lever. Same thing. You're going to do everything like you've done with any of your other needles. And here, once you remove the needle, you're going to hold onto the wing, insert it into the patient into the vein. And then when you're done, you are going to slide the body part up until all of the needle is covered. But those are pretty much all of the needles that I wanted to show you guys. I really hope that was helpful. I really hope that I really sucked you in and kind of, definitely demonstrated a lot on how you will use these needles in your phlebotomy career. The world is just becoming more high-tech, and 10 years from now we may have a whole different set of needles that we're going to be using for our blood draws. You just never know, honestly. Now you may have different ones that you will work with. Like I said, it also depends on your laboratory and how they do the supply, who handles supplies, and what brands they use and different things. Most of the time everything pretty much looks the same, from different brands. It's just like a little certain things that they'll tweak a little bit or however. But like I said, always ask questions if you don't know how to use certain devices or anything of that nature. Most of that stuff you will talk about in your phlebotomy courses, and they will explain everything between straights and butterflies and syringes and whatever else that you need to do and to further you in your phlebotomy career. But that is pretty much all that I have for this video. I really hope this definitely inspired anyone or definitely taught you something. Please leave a like on this video if you thought this video was helpful, and I hope to see you all in my next video. Bye.